Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Percutaneous Endoscopic Gastrostomy, PEG. Introduction. Sometimes healthcare providers need to place a tube that goes through the skin and abdominal wall directly into the stomach. This tube is used to provide nutrition and medication for patients who cannot eat enough or swallow on their own. Percutaneous endoscopic gastrostomy is a procedure in which a healthcare provider inserts a tube through the abdominal wall into the stomach. It is called PEG for short. This program explains what a PEG tube is, why and how it is placed, and what to expect after the procedure. Anatomy. The food we eat normally goes from our mouth to the stomach through the esophagus. The esophagus is a muscular tube that connects the mouth to the stomach. The food then goes into the stomach where it is partially digested. The stomach is protected by the abdominal wall, which is made of layers of muscle and the skin. From the stomach, the food goes into the small intestines, where it is further digested and absorbed. Food travels from the small intestine to the large intestine, or colon. From there, whatever has not been absorbed is passed to the outside as stools. Stools are also called feces or poop. The stomach, the small intestines, and the large intestines are protected by the abdominal wall, which is formed of layers of muscle, fat, and the skin. Percutaneous Endoscopic Gastrostomy. Percutaneous endoscopic gastrostomy is a procedure in which a healthcare provider inserts a tube through the abdominal wall and into the stomach. It is called PEG for short. The P in PEG stands for percutaneous. Percutaneous means through the skin. The E in PEG stands for endoscopic. An endoscope is a flexible tube with a camera on it. It is used to help healthcare providers place the tube. It helps them look inside the body without making big incisions. The G in PEG stands for gastrostomy. A gastrostomy tube is the name of the tube that is placed in a PEG procedure. Gastrostomy tubes are also called PEG tubes. Indications. A gastrostomy tube is often placed because someone cannot eat enough or swallow on their own. For example, a person in a coma who is not awake enough to swallow safely may need a gastrostomy tube. When someone cannot swallow safely without choking, a gastrostomy tube may be needed to prevent the food from going into the lungs and causing serious lung problems. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatment. As an alternative to a PEG tube, sometimes healthcare providers use a nasogastric tube, also known as an NG tube, to feed patients. This tube goes through the patient's nose, through the back of the mouth, and into the stomach. The NG tube may irritate the nose and throat if it is used for a long period of time. The NG tube may also move out of place, causing food to spill into the lungs, which can be dangerous. Placement. PEG tubes are placed at a healthcare facility. The procedure can be done in the operating room or a special procedure room. It takes about 20 minutes to complete. Patients can usually go home the day of the procedure or the next day. Your healthcare provider will give IV antibiotics through a vein before the procedure to decrease the chance of infection. You will receive an IV sedative to help you relax for the procedure, as well as local anesthesia to control the pain at the site of PEG placement. The sedative may make you drowsy. A scope is threaded through the mouth, down the back of the throat, and into the stomach. The scope allows the healthcare provider to see the inside of the stomach, allowing the proper placement of the PEG tube. This part of the procedure is called endoscopy. Following the endoscopy, The doctor makes a small incision in the skin above the identified site of PEG tube placement. The doctor inserts a wire through the incision to the stomach, then pulls it out of the mouth. Finally, a PEG tube is inserted over the wire, which passes through the stomach wall, muscles, and skin to the outside of the body. The tube has an internal safety disc that prevents it from falling out. It also has an external bar, which keeps the tube from moving inward or back and forth. Risks and complications. Inserting a PEG tube is safe. However, there are possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Some risks of the PEG operation are common to any type of surgery. These include pain, infection, bleeding, and scarring. Pain can be treated with pain medication. Excessive bleeding can often be controlled surgically and, if necessary, can be treated with a blood transfusion. Antibiotics are always given prior to PEG placement to decrease the risk of infection. If an infection does occur, the infection can be treated with additional antibiotics. In rare cases, the procedure may need to be repeated. Some risks are related to anesthesia. These risks may include allergic reactions, cut lips and chipped teeth, headache, nausea or vomiting, problems with urinating, sore throat. Your healthcare provider will discuss these risks with you and ask if you are allergic to certain medications. Tell your healthcare providers about all your allergies before the procedure. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Other risks and complications are related specifically to this procedure. These are rare, but it is important to know about them. Organs inside the abdomen can be injured, including the intestines and their blood vessels and nerves. These complications are rare. Hernias can happen around the opening. A hernia is when an organ pushes through the abdominal wall because of weak abdominal muscles. Some risks are related to the PEG tube itself. The tube may not work correctly or it may get dislodged. Stomach contents could leak from the tube. The tube could fall out. If this happens in the first few days after the procedure may have to be repeated to insert another tube. If the tube falls out later, it can be replaced easily. Contact your healthcare provider right away if the tube falls out. PEG tubes can last for months or years, but because they can stop working over long periods of time, they may need to be replaced. Your healthcare provider can easily replace a PEG tube. After the procedure, you may have some mild tenderness at the site of PEG placement for a couple of days after the procedure. If the pain is severe and it is accompanied by a fever or drainage from the insertion site, you should call your healthcare provider. Your healthcare team will explain how to keep the area around the PEG clean. Your healthcare team will teach you how to measure the external length of your PEG tube. This will ensure that your PEG tube is staying in place. Your healthcare provider will give you instructions on how to feed through the tube. A PEG does not stop you from eating or drinking, but you may need to limit what you eat. Your healthcare provider will help you choose a special formula for the tube feeding. Follow these steps to care for your PEG tube. 1. Wash your hands for 20 seconds before touching the stoma. Wash the stoma area with soap and water once a day. 2. Turn the tube in a half circle or 180 degrees daily to prevent the crossbar from getting too tight. The outside bar should never be so tight that it causes pressure. This bar can be easily pulled back if it seems too tight, but it must fit snugly. 3. Always measure the external length of the PEG tube before every use. 4. Always flush the tube with water before and after giving medicines in feedings. You can usually take a bath 2 weeks after surgery. Your healthcare provider will give you instructions. When and if the tube is no longer needed, it will be taken out by your healthcare provider. Over time, the opening between the stomach and the skin will close off. Only a small scar will remain. Call your healthcare provider immediately if the tube comes out, the tube becomes blocked, you are unable to get food through the tube. Contact your healthcare provider right away if you have a lot of drainage around the tube, you have a high fever, you have severe pain, you have redness and tenderness at the insertion site.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A PEG tube may be needed to help provide foods, liquids, and medications if a patient is unable to eat enough or swallow on his or her own. Putting a PEG tube in and taking it out when no longer needed are relatively simple and safe procedures. Complications are rare and can be treated if they happen. Make sure to learn from your healthcare team how to use and take care of your PEG tube. Thank you for using Explain.